Several sedative drugs may give you sexual fantasies. Sedative hypnotics were most often associated with sexual hallucinations. Key points. Sexual fantasies were associated with the use of benzodiazepines, propofol, ether, chloroform, and ketamine. The sex of the patient and therapist played a role in the nature of the sexual hallucination. Most of the drugs involved enhance the function of the neurotransmitter GABA in the brain. Some affected patients have sought legal action for sexual assault against the healthcare provider. A recent review of the literature found ample evidence that some sedative hypnotic drugs can cause vivid sexual hallucinations. The analysis discovered that sexual fantasies are most often associated with the use of benzodiazepines, propofol, nitric oxide, ether, chloroform, and ketamine. Healthcare professionals need to be aware of the potential risks to the patient and legal risks for themselves. Out of 87 cases published, 41% of the reported sexual fantasies were associated with the benzodiazepines midazolam, a premedication before surgical anesthesia, and diazepam. Dose played an important role. Sexual hallucinations occurred only when the doses of midazolam or diazepam administered were rather high. Propofol produced sexual hallucinations in 2 studies when doses greater than 30 milligrams or 2 mg were administered. Sexual hallucinations, or sexual fantasies, have also been reported after administration of surgical anesthesia. In one study, 110 dental surgery patients, or about 13.6% of the total number included in the study, reported episodes of sexual dreaming, hallucinations, and/or sexual arousal after being administered a standard cocktail that included fentanyl, diazepam, and methotrexate. The nature of the sexual episode varied. 60% reported some form of sexual dream during the surgery, while 13% had sexual dreams after they returned home. About 10% of patients reported experiencing unpleasant sexual hallucinations while in the recovery room. The impact of the sex of the patient and therapist. In a report of approximately 300 predominantly male patients undergoing a urological procedure, none of them reported having a sexually related dream when the surgical team was all male. However, 40 male patients had a female anesthesiologist, and one of them reported having a dream about her during anesthesia, but was unwilling to elaborate on the nature of the dream. 12% of 130 female patients undergoing propofol and alfentanil anesthesia for dilation and curettage, cystoscopy, or cervical biopsy reported experiencing amorous or disinhibited behaviors while sedated.